In April 2020, 1 in 5 South Africans were going to bed hungry. The country had implemented a strict lockdown, and millions of casual workers had lost their jobs. The existing system of food parcel distribution was overwhelmed, and there were issues with logistical management and theft. There were nightly images on the news of snaking queues for food that always ran out. The economic crisis required an immediate, urgent policy response. Traditionally, most welfare support in poor countries is given in the form of food packages. There's been growing interest among economists in distributing cash directly to poor households without conditions, an approach called unconditional cash transfers. I am Associate Professor Kate Hawken. Before the COVID pandemic, I led an ESRC-funded randomized control trial in Kenya to test this approach. We evaluated giving poor households once-off unconditional cash transfers across 415 villages in a sample of 8,000 people. 17 months after getting the cash, we find recipient households use money in constructive, resourceful ways, buying more and more nutritious food and using cash to start or expand businesses. They work more hours and they earn more income. I also do extensive research in South Africa. As the COVID pandemic hit, I was commissioned by the government there to provide policy advice on how government could provide emergency assistance at scale. With a team from the University of Cape Town, we reviewed international evidence on cash transfers and built economic models to simulate the effects of different policy interventions. Based on our recommendations, in May 2020, the government shifted to delivering emergency relief as cash rather than food parcels. They increased the amount paid to people getting pensions and child benefit, and they also set up a new emergency monthly cash grant for 10.5 million unemployed people who'd never been eligible for welfare before, using an innovative mobile phone-based application and payments process. Before these policy shifts, only 1.2 million people were receiving food parcels. After these changes, within a few months, 28 million people were receiving emergency cash grants. An independent study found that these transfers kept 5.5 million people out of extreme poverty during the first lockdown.
With food parcels, it's a bit tricky than it is with the money initially, because now a job opportunity comes, you cannot take a food parcel to go get there. You need money to get there. It's more smart because a person can actually get what they need or they feel that is best suitable for them.
When the COVID-19 pandemic arrived in South Africa in early 2020, we had to act very quickly to get support to those who needed it. And in the end, South Africa implemented one of the most rapid, far-reaching and effective emergency cash transfer programs in the world in response to the pandemic. In doing so, we drew on the advice, the data and the evidence of Professor Hawken and her colleagues at the University of Cape Town about delivering emergency assistance to the most vulnerable South Africans and providing recommendations to increase employment in the longer term.
Our team received further ESRC funding to support the government in redesigning the social welfare system after the pandemic. The main beneficiaries are unemployed people living in food poverty.
We made 3 major policy changes, including the biggest expansion of the social safety net since the early 2000s, based on the modeling and evidence delivered by the research team. We changed our method of emergency delivery from food parcels to mobile cash payments, which enabled us to rapidly increase the reach of the program. We established the Temporary Social Relief of Distress Grant, the first comprehensive unemployment grant in Africa. The grant had reached over 10 million people by the end of March 2023.
I have a cousin. He was unemployed for about, 6 years. He used the 350 to find a job, so it helped with the transport, printing the CVs, going for the interviews as well, and getting a decent outfit for the interview.
Studies have found that the program has increased recipients' probability of searching for a job. Recipients have also started small businesses and invested in assets to make their businesses more productive. Giving people this cash has given them dignity and the possibility to make choices that improve their lives.